So if you can imagine the anxiety of having that constipation or that chronic lethargy from constipation, I mean, that in itself may affect seizures.
Poo. We don't really bring up issues regarding constipation or the reverse enough. Well, today I'm talking to Sally-Ann Remnant, an epilepsy nurse specialising in helping those who have epilepsy and intellectual disability. Sally's great, and she'll be telling us about her study into constipation amongst those with epilepsy and intellectual disability, and indeed how constipation may encourage epileptic seizures. We talk about how digestive issues are something for nurses and doctors to bring up with people with epilepsy, but also vice versa. So, if you want to hear more about this sillily taboo subject, and which generally isn't given enough attention, and if you haven't already and want to, then please do subscribe to the channel and hit that bell for notifications. Together, let's improve outreach, epilepsy awareness, understanding and research funding.
Hi Torie. So my name is Sally-Ann Remnant, otherwise known as Sally. I am an adult epilepsy nurse specialist, and I'm based in Brighton. And I also work for myself. I have a company called Epilepsy Explained, which basically provides myself and some amazing colleagues who are trainers, clinical trainers. We teach, well, I'd say all around the country, but it seems to be mostly the south, all about epilepsy, rescue medications specifically, because obviously there's a huge need in care organisations to know about that, know how to safely administer rescue medications like buccal midazolam. And also I do consultations with private patients sort of around safety and SUDEP, and again clinical teaching, and I'm often asked to do some advisory things, policy writing, and I'm also an executive member of ESNA since December, which is a privilege. So ESNA is the Epilepsy Specialist Nurse Association for the UK. And I think my role, actually, which is great, is kind of an international ambassador to start getting some of our nurse and colleagues and clinicians from all over the world to come and join us and benefit from our knowledge, share knowledge, and for us to benefit from theirs, because supporting people with epilepsy is not just the UK. It's very different if you think about other countries, especially more maybe socially deprived, financially deprived and medically deprived countries. So that's my role, as well as getting my finger in lots of other pies.
Well, we were actually just talking about having one's finger in too many pies sometimes, weren't we? Like,
oh God,
because you've got such a passion for what you do. Sally and I know each other, by the way, and we met at an International League Against Epilepsy conference, didn't we? But you just do so much, and it's important that we kind of focus our energy and everything on fewer and prioritise. Yes. So, and talking of prioritisation, we're going to talk about something which is not spoken of enough. Reminds me of the chat a wonderful Charlotte and I did about sex when you have epilepsy. We're talking about constipation. There you go, put it out there. Pooing when you have epilepsy. It's generally a thing that I think Homo sapiens tend to do, is pooing. But it's often, well, you tell us about your work to do with poo, and your studies to do with poo, and what you've learned from that, and what we can learn from that, both clinicians and patients.
Typically nurses, we're always involved in poo in some way or shape or form, literally. But my interest came when I was doing my the medical MSc at King's a few years ago in epileptology, and I was asked, doing the research study, what are you going to choose? And I thought, well, there's so many things. And I remember talking to colleagues to say, well, we still haven't found out whether constipation has any relationship with maybe triggering seizures. And I said, well, it's a given. We all know that. I've spoken to colleagues. So anecdotally, we all realise that there is an aspect that, constipation can trigger off seizures in lots of people that we support, especially people maybe with neurological difficulties or more profound or moderate or profound learning disabilities. So I asked around a few colleagues just to sort of get a feel of whether it would be relevant. And it was all, yes, someone's got to do it. We've always wanted to do it and no one's ever done it. So my wonderful mentor, Lena Nashef, who is the consultant, one of the consultants, epileptologist really, at King's College, she was my mentor and she supported me in sort of doing this research. So would you like to know a little bit about the research?
Yeah, definitely. Tell us, because as I said, it's something people don't talk about, and we need empirical evidence to back up our supposed claims about pooing and its link to epilepsy.
So, I mean, I was very lucky enough to do this at King's and have the backing of King's. And I must admit, I did really well in my master's because of this research. And also, I won the Bateman Award for it. And also, I won a poster award for the novel research as it was. When we went to the ILIA week in Prague a few years back. But so the nature of the study really was to, we put a focus group to see if it would be of any interest, just to see whether this actually is anecdotal, is it worth researching? And it was. And then we put a pilot study together. So I worked and was close to an epilepsy service in Surrey who cared for and supported people with learning disabilities and predominantly epilepsy. So I approached them with my research hat, and they were really happy for me to go along and to look at the books. There wasn't so much ethics involved because we were looking at retrospective anonymised data. So we looked at, the royal we, that was me. I looked at about 63 or 65, I think it was, people with learning disabilities who live there. So I'll call them patients for now. It had an inclusion and exclusion criteria of they had to have certain seizure types. They had to have, that guaranteed, not non-epileptic attacks or anything like that, or dissociative seizures. So anyway, the ones we had left was about 11 of them. And what we did, we captured data about their seizures, and then we captured correlated data, so seizure charts and bowel charts relating to their constipation. And how we actually diagnosed constipation, we used a theory called Rome 3, and it's an assessment process where we identify whether someone's constipated or not. Now, I know people say, well, we should know when we're constipated. It's easy. We strain, or we don't go to the toilet, and we don't talk about it. However, there has to be strict criteria, because you can't all be constipated and you can't all not be constipated. So the kind of things that they look for are if your bowel is infrequently open, sort of less than 3 times a week. Now, for some people listening to this going, oh, that's normal for me, but for others it's, oh my goodness, that's awful. And then one of them, just such an example, is if you strain for maybe a quarter of that time. And that is in itself, a problem. And also the other one is if you have hard stool. So when I say the word Maltesers to everyone, I'm not talking about the chocolatey variety. I am talking about the pebbles that we recognise. If you ever looked at the Bristol stool chart, there's a chart of what should your poo look like, which is fun. And I actually got some mugs made for colleagues when I was
poo mugs, great.
I loved it. I don't know where my mug, it's gone missing, I think. Anyway, so we got this data, we correlated, and we found something like 75% of this 11, I know it's only a small group, actually had an increase in seizures when they were then constipated. So we had the evidence that there was some sort of statistical significance, that there was a relationship. I mean, this is a pilot study, and this could be taken further, of course, but also it looked at it kind of, well, let's put a theory out there. Why could this happen? Why would seizures increase? Most of these people who we narrowed down into having this relationship between constipation and seizures, they also had temporal lobe epilepsy, which, as you probably know, is can be an autonomic reason behind temporal lobe epilepsy. And we were wondering maybe that was something to do with it. But the other sort of thing that stood out a mile really was we knew about how chronic constipation can affect the way your bowel moves. So, when you eat something,
it doesn't move. Yeah.
It doesn't move or doesn't move. So when you eat or take tablets, it takes a while for it to be gastric emptying into the small intestine. So the small intestine is the massive part. But when it's it's got more surface to absorb your drugs, and also it has to go around those long tubes. But anyway, so basically what we're saying is that constipation that could be caused by drugs or the underlying neurological problem has had an effect on the motility of the medication, and thus the drug absorption. So the drug absorption then would possibly go down, which then makes them vulnerable to seizures. So we didn't look into that bit. So I'm hoping that anyone listening to this may look into that side and prove that as a point.
I hope they may also look into the fact that constipation can be so stressful. Like, so even disregarding potential effects on absorption of anti-seizure medications, the stress and literal pain caused by constipation could massively affect a person's likelihood of having a seizure. So I think there are different angles to look at this, right, in potential continuation of this study.
So, I mean, if you've been constipated, I think we all have, and you know you've got to get on with your life and get on with your day, you know, that has a knock-on effect of, oh my God, I don't really want to go out today because I feel terrible. Or what about if I go to work today, or I have to do this presentation today, and then suddenly my bowel's open, you know, because it's time. And the anxiety of that. So if you can imagine the anxiety of having that constipation or that chronic lethargy from constipation, I mean, that in itself may affect seizures. I mean, there's no proof out there, but it's all anecdotal. But there's a few studies waiting to happen, definitely. So yeah, it was really good, and I'm hoping to publish it at some point. It is retrospective data, but it'd be nice to open up the floor to more people getting involved. I'm happy to get involved a little bit with maybe the looking into further studies with constipation and the effects on seizures. But I won the award saying that I've basically identified that constipation is a likely trigger for some people with their seizures, and that's people mainly with maybe neurological problems, functional problems, so bad diet, you know, not having good mobility. Some of the group had cerebral palsy, so they couldn't move, they couldn't walk, they're in wheelchairs, and so they had an underlying neurological problem that basically affected how the bowel worked anyway. So they were kind of it was a given, sadly, that they had this constipation problem. So it was always going to be there, and we needed to manage it better so that it didn't affect the seizures, but it did affect seizures in these particular respondents. When I did my research, and I've obviously been looking around the subject before we started talking, just to see if there's been any more research out there, and there hasn't been, except for this study in 2015. You'll find it in Epilepsy Behaviour Journal, and basically it's called Constipation Enhances the Propensity to Seizure, so the risk of increasing seizures in especially particular drug induced seizure models in mice. And what they looked at was two groups of mice, and as you probably know, mice have a very similar brain structure to humans, same as cats and so on. One group is obviously like an epileptic mice, so they've been drug induced, had seizures, and they have perpetual seizures, so they what we call an epileptic seizures mice seizuring group. And they were given loperamide and another drug to cause them constipation, and they were all affected in this group, causing them to have worse seizures when they were constipated. So there has been a trial as such in an animal model showing you that there is an actual physiological link between being constipated and actually having seizures. So I think taking my study and maybe looking at this does give you a little bit of ammunition, a little bit of information to maybe go on and look into this a bit further, which would be brilliant. But there's nothing else out there, but maybe we should do some more research.
You're making me think of, and we discussed this before recording, but there was a case of a gentleman who had Down syndrome, and he struggled with abilities to communicate effectively. And wow, you continue this story. It's an awful story, but one we can certainly learn from.
Yes, so I have the paper here actually, and I hope you don't mind me sharing. So it's a bit of a sad paper. Reading between the lines. So this is a lovely gentleman that was in 2018, I think, called Richard Handley, and he had a background of learning disabilities and Down syndrome. Now he had chronic constipation. I think he was probably conservatively treated, with laxatives, and if you're using laxatives all the time, you can get very much a lazy bowel. And he had a very large tummy. So eventually they identified that this was constipation, probably too late, and went in, had an operation. And then he died after a heart attack because he inhaled, after the surgery, some of the bowel content or faeces. He vomited it up because obviously with constipation it can affect, and you can vomit faeces actually. And that's what sadly was how he died. So this is a really sad story because he lost his life because of the complications of constipation, and I think very much it was not picked up. It should have been picked up earlier. And this is a person with Down syndrome and chronic constipation, but this could be someone with epilepsy who has extreme or chronic constipation. It's even more important to make sure that we're watching bowel care, supporting bowel care, and referring on to the right people, because this can ultimately lead to fatalities such as this case. But more importantly, these people deserve to be looked after, not just here, but everywhere else as well.
Be physically comfortable as well as neurologically and psychologically.
I'll tell you a little bit more about constipation generally. I mean, you'd be blown away about the sort of statistics and how it affects us all. So the cost on the patient and the issue with the patient having constipation, but the cost on the NHS, especially in the current climate, we're looking at about £150 million spent because people come into hospital and they end up in the wrong department and they cost a lot of money to sort of remedy. Whereas if they'd been treated beforehand, before going into hospital, that would have saved a lot of patient time, patient discomfort, and obviously NHS money. Now, there's over £100 million just spent on prescribed laxatives, and I don't know how many millions are spent over the counter. And I say that because most people are too embarrassed, as you said, to talk about constipation, so they don't go to the GP. They might, especially the chaps, they'll go off and either pick up something or get their wives or partners to pick up something over the counter. And if they can't remedy themselves, there's only about 25% that will actually then go on to the GP and say, look, I've got a problem. So this builds up, and then you can see why people end up in agony, thinking they've got some sort of appendicitis or something like that, or worse, end up in hospital, and we find out, oh my goodness, this was constipation, this should have been treated a while ago. You've kind of ignored the signs, or your diet, the usual stuff. But what was really interesting is in 2014-15, this is where the studies come from, there was over just under 70,000 people admitted just for constipation. I mean, that's horrendous. And then so 50,000 of these were unplanned emergencies. That was like 133 people a day coming in with just constipation.
Well, it's interesting you say with just constipation, but it's never going to be just constipation, is it? That is the box that was ticked to come in, but there are going to be other things alongside that, no doubt, that cause the constipation.
I also think when people come into clinic and they bring their questions, and I think it's quite important for clinicians to actually have a little box there to say, how are your bowels? Because we never ask that question, because it's embarrassing. And we ask women about periods, because obviously there's a small 10% of women that have seizures brought on by different estrogen, progesterone levels before periods, but we don't ask about poo, because people are like, oh, it's fine, thank you very much, thank you, why should I be talking about poo, what's that to do with my head? So it's a question that really needs to be brought up. And if the bowel's fine, that's fine. But if you start to pick up these chronic bowel issues and constipation, we're all connected. And don't forget, our second brain actually lives in our gut.
Wouldn't it be interesting, actually, if somebody, whether it's the individual with the epilepsy or carers, whoever, when they do a seizure diary, if they could put down, how's your tummy at the same time? Do you have regular defecations, or are you bunged up?
When I do my teaching, it's very much I've got a whole slide on triggers, and it's very much in there, and I tell them the story about how I kind of sort of researched it. And then we always ask, when we do our seizure description, there's a box there that please tell us all about triggers, whether it's they're excited, they're sad, they've been ill, they've had a COVID vaccine, they've had the flu, and whether they were constipated or whether they're menstruating. So we have that as a thing to pick up, because in this field that this area that I look after, so people who learn disabilities, as you say, there's a high population of people who learn disabilities and neurological difficulties that have epilepsy. So if you've got a neurological difficulty, it doesn't just give you epilepsy, it can also give you other things, such as how you process the bowel movements and things. So bowel should definitely be on the let's just ask that question, especially as it's can't be identified as a trigger now, so it should be on there.
Yeah, I think that would be great. And again, I'm thinking of people with lack of mobility, course, like lack of jigging your bits all around you. It's like even just walking really helps. So you're thinking of people who don't have physical mobility. That is going to be such an issue, likely, I imagine. Would be really interesting. I don't expect anybody to, give me a poke to tell me, but that is how many people listening to this have bowel issues, have constipation issues, and if you've ever been through that as a clinician or a mum or a dad or a brother, sister, recognize that, how that might feel for the person that you love or your patient, and think, okay, that on top of the fact that maybe that brings on seizures.
Can we just flip it around? Because I'm not embarrassed. I'm going to have a IBS, so I go to the loo a lot, which is not fun. Sometimes when you do plan to go out, you get a bit nervous and things. But generally, it's not just about constipation and whether that affects seizures, drug absorption, and so on. But if you're having diarrhea or having frequent bowel openings, runny frequent bowel openings, then that can maybe affect in just the same way. So I think if it's any bowel problems, treat it as a proper, problem and get it seen to. So don't just rely on that algorithm of laxatives, especially laxatives that causes a lazy bowel.
Can be very dangerous.
It needs to be seen by, if it's not working and it's causing problems, you need to see a specialist. And I know King's, when I was there, were working on this constipation pathway to make sure people who came in with that issue were seen by the right people, to help people, but also to reduce that burden of cost, which was unnecessary, really, in the UK. I'll tell you a little story about, you'll love this, Torie, I know you. So I worked at King's doing this project, and I also learnt about a product called Peristine. Now, what do you think that is when I say Peristine? You think of periscope, don't you?
Okay, I should do. Yeah, go on.
I learnt and actioned, implemented this Peristine product, which is so people with severe, maybe neurogenic bowels who have awful constipation, they can't help themselves, and they've tried everything. And then they came to me at this particular point, and I had this product where you inserted it into the rectum. It stayed into the rectum like with a little balloon that kind of kept it there, and you gently pumped from a little bag, gently warm water, and it you did it sort of every few days, and it chipped away. I mean, you can imagine it chipped away.
Like a boulder of poo that it's chipping away at.
Oh my goodness. So can you imagine a brick wall, and if you got a sledgehammer and you just sort of tapped a little bit here and a little bit there, you're not going to knock down the wall. So then you do a little bit more, and you do a little bit more. Now you've weakened the surface. And then you do a bit more, and you do a bit more, and then suddenly, hey, it all goes. And that's what this product was like. And I must admit, the patients were extremely happy. And I was so grateful that we had this Peristine to work on some people. And I think this is where people need to be identified. If they've got chronic constipation, they need to be seen, and then they need to go through that trial of all the different things that can help them, so that they reach the thing that helps them the most. So it's not bowel irrigation like you would get at a spa, because that can be wonderful, and it goes higher up in the bowel. It's just the rectum, so it kind of, and then it stimulates the bowel to open. So it's been quite effective, actually.
So Sally, if anybody is interested in continuing and working with you further on this research project, what should they do?
Well, you can give out my NHS mail address. That'd be fantastic. I think what I'm looking forward, I'd be really pleased to advise on someone taking this project further, and maybe using some of my data and then maybe co-author. But as you said, I've got my finger in too many pies. I don't want to do the whole thing, but if someone wants to take this idea and work with it, I do think it's a project that could help a lot of people.